All right, thanks, Alex. Well, skin cancer is one of the most common forms of the disease.
That's right. According to the Skin Cancer Foundation, 1 in 5 Americans will develop skin cancer by the age of 70. And to talk about this, we want to welcome in Dr. Joe Stilwill. He's an oncologist from HCA Midwest Health. Doctor, welcome in. It's good to see you.
Great to be here.
Dr. Joe, why is skin cancer so common?
You know, I think skin cancer is really related to sun exposure, and we're all outside in the sun, and we all are exposed to those UV rays, and so it's something that is something that we all have to be considerate of.
Doctor, the most deadly skin cancer is known as melanoma. In fact, that's how I lost my grandpa a few years ago. Can you talk to us about the different forms of melanoma?
Sure. You know, melanoma comes in different stages, and obviously the earlier stage, the better the prognosis. And so finding melanoma when it's small and at an early stage is far more curable. And so I think that's a big part of awareness and something that we really need to consider.
Okay, help us understand what are some of the common signs of skin cancer. We should always get an annual checkup, but for ourselves, in between those times, what can we look for to see if there's a problem? Sure.
So, you know, obviously melanoma makes up a small percentage of skin cancers, and so anything that looks unusual to you, you should definitely see your primary care physician or your dermatologist. But for melanoma specifically, we look at what we call the ABCDEs, and so things like this asymmetry, which looks different on one side than another. The border, which can be sort of fuzzy or not clear cut. You know, the color, and sometimes the color of melanoma can be anything from a black to a brown to even like a dark blue. And they can be sort of heterogeneous, so not the same throughout. The diameter, so anything bigger than a pencil eraser is something that we want to get checked out. And then evolving, so something that's growing is something that we want to definitely get evaluated.
Okay, so ABCDE, that makes it easier for all of us to remember. Yeah. So in these summer months, it seems though a lot of people are outside, you know, at the pool, gardening. What does that have to do with us getting that skin cancer diagnosis?
So skin cancer is really related to the amount of exposure that you have to that ultraviolet light. And so, you know, obviously, if we can avoid being out in the midday hours, I think that significantly reduces our risk. But that's certainly not something that we can do all the time. And so obviously making sure that we're being covered, whether that's with clothing or with sunscreen, can make a huge difference.
Yeah, and you know, there's more and more clothing. If you don't know, there's clothing out there that has like SPF in it that can reflect the sun away. I imagine those are some of the other ways to protect ourselves from the sun, right?
Absolutely. And, you know, the advances they've made are great. They're much cooler, and so they provide that protection without kind of being really warm and stifling.
All right. Dr. Joe Stilwill from HCA Midwest. Good to see you, Dr. Joe. Come back and visit us again. We'll chat.
Great. Thank you very much.
Thanks a lot.